Breast cancers can be classified into non-invasive as well as invasive cancers. Non-invasive breast cancers include ductal carcinoma in situ and lobular carcinoma in situ breast cancers. These cancers can sometimes be adequately treated and cured just by surgery and/or radiotherapy alone without the need of having chemotherapy. Invasive breast cancers include invasive ductal carcinomas, invasive lobular carcinomas, Paget's disease of the nipple, and inflammatory breast cancers. Invasive breast cancers are then further grouped into subtypes based on the gene that the cancer expresses. These include estrogen and progesterone receptor breast cancer, HER2 positive breast cancer, and triple negative breast cancers. The types of systemic treatment offered for early breast cancer is dependent on the subtype of the breast cancer. For example, if a patient is diagnosed with estrogen and progesterone positive breast cancer, they'll be offered hormonal therapy as part of their treatment. If they are diagnosed with HER2 positive breast cancer, targeted therapy will be included, and if it is triple negative breast cancer, neoadjuvant chemotherapy and in certain cases, immunotherapy will be included. The purpose of neoadjuvant chemotherapy is to shrink the tumor so that breast-conserving surgery such as lumpectomy instead of mastectomy can be offered to the patient. In addition, it allows the doctors to gauge the efficacy of the treatment, and if a drug given pre-surgery does not work, then the doctor may choose to change the treatment after surgery.
There are two main surgical options for the treatment of breast cancer. The first is known as a lumpectomy, and second, a mastectomy. Lumpectomy, also known as wide excision or breast conservation surgery, involves removal of the tumor together with a rim of normal breast tissue. Lumpectomy is often the preferred choice of treatment for patients because it preserves the cosmetic outlook of the breast. However, lumpectomy is not suitable for all patients. Patients who are suitable for lumpectomy include patients with a small tumor in relation to the breast size volume, or patients who are suitable for radiotherapy. There are two types of mastectomy. The first is a simple mastectomy where the entire breast is removed without any form of reconstruction. The second is known as a skin-sparing or nipple-sparing mastectomy, where a large part of the breast skin or the nipple areolar complex is preserved. This is followed by an immediate reconstruction at the same time of surgery or a delayed reconstruction. Mastectomy is indicated firstly in patients with multifocal breast disease who have more than one tumor foci in different quadrants of the breast. The second group of patients will be those who have a large tumor in relation to the breast size, and hence cosmetic deformity would be significant if a lumpectomy is carried out. The third group of patients will be those who did not respond well to neoadjuvant chemotherapy, where tumors did not shrink enough to make lumpectomy amenable. Assessment of the lymph node is essential for staging of breast cancer as well as in prognostication. We usually carry out a procedure called a sentinel lymph node biopsy. This involves injection of a blue dye or radioisotope material around the nipple area. This material will then travel up to the axillary lymph nodes, and the lymph nodes that turn blue or pick up radioactivity will then be biopsied for immediate assessment. If any of these lymph nodes turn out to have tumor cells in them, we'll proceed to what we call an axillary clearance, where all lymph nodes draining the breast will be removed. Lymph node surgery is safe, and in sentinel lymph node biopsy, there are hardly any complications to speak of. However, in axillary clearance, we can expect to have some numbness in the inner one-third of the arm or a lymphedema. Lymphedema is known as swelling of the affected limb, and this is due to a decreased lymphatic drainage of the entire arm. This occurs rarely in about less than 5% of all the cases that we do.
Radiotherapy is given through a radiotherapy machine called a linear accelerator, and this is actually X-ray treatment. So with lumpectomy, we usually recommend radiotherapy to be given after that to reduce the risk of local recurrence. the local recurrence can be reduced from 25 to 30% to under 10%. So it will be similar to a mastectomy. So a patient can avoid having the whole breast removed and still get the cancer treated adequately. The duration of the treatment usually is over a 4 weeks period, given Monday to Friday, and no treatment on Saturday and Sunday daily. Each treatment only lasts for 3 to 5 minutes.
Stage 4 breast cancer refers to breast cancer that has spread to other parts of the body, such as the lung, liver, bone, and sometimes even the brain. The treatment options for stage 4 breast cancer include chemotherapy, hormonal therapy, targeted therapy, and radiation therapy depending on the symptoms of the patient and the subtype of the breast cancer. Unfortunately, when a patient is diagnosed with stage 4 breast cancer, we are unable to cure the patient completely. This is because we are unable to get rid of all the cancer cells in the body with systemic treatments that we have. In this case, the aim of the treatment is to control the cancer, prevent further spread, and to improve the patient's quality of life.